This is Arzu here and welcome to my channel Mr. Teeth, where your dental concepts get dissected. So the topic of today's video is deciduous dentition versus the permanent dentition, and in this video I have tried to incorporate all those things that are required for our board exams. Okay, so this equation is very important during our board exam. They may ask in a long question answer, so if they ask in a long question answer, so if you write in such a pattern, they would give a full marks. And also this video is also important for the viva questions. Okay, so sometimes they can ask till the 5 difference or till the 10 difference between the deciduous dentition or the permanent dentition. Okay, so now without delaying much, let's start. So our first point is eruption and the exfoliation. As I have written here, it starts at the 6 month and continue till the 3 years. Okay, so deciduous dentition, it starts at the 6 month and continues till the 3 years, and it is exfoliated by the 13 years, and the exfoliation is a physiological. So as it is a physiological exfoliation, so it signifies the name called deciduous. So also this dentition is called deciduous dentition. Also I have left to tell that it is this dentition, also the tooth that is present in deciduous dentition also called milk tooth. Okay, milk tooth or baby tooth. Okay, baby tooth. Similarly, in permanent dentition, the tooth that is present, it is called adult tooth. Adult tooth. So in permanent dentition, it starts at the 6th year and continues till the 25 years or the more. It stays in oral cavity for the longer time, and there is not primarily exfoliation of the permanent dentition. So number and types, there are total 20 number of teeth in deciduous dentition and 32 in permanent dentition. That includes the 2 incisor, 1 canine and 2 molar in deciduous, and 2 incisor, 1 canine, 2 premolar and 3 molar in permanent dentition. I have discussed with this in my first video. Similarly, the size, they have quite smaller in size than the permanent successor, and they are greater than deciduous dentition only. And here is one exception, that the mesiodistal width of the primary molar is greater than the mesiodistal width of the premolar. As we know that at the place of the primary molar, the permanent successor will be premolar. So the mesiodistal width of the premolar, that is permanent, is less than the mesiodistal width of the primary molar. So that I have written here. Now after that, in the shape we can see here the cusps are more pointed, they are more blend here, they are more bulbous in deciduous dentition and less bulbous in permanent dentition, and contact area are smaller here and contact area are more broader. Okay, now after this, in the features again we can see here I have written color. So in color we can see that as enamel is less translucent here, they appears milky white. Okay, enamel is less translucent and they appear milky white. Here the enamel is more translucent and appear bluish white, glistening and slightly yellowish. Due to the more translucency of the enamel in the permanent dentition, there is a less opaqueness of the enamel, due to which the dentin, which is yellow, is little seen outside from the mouth. Outside the tooth it appears slightly yellow. Similarly here it is milky white, that is more opaque enamel is present here. And one thing I want to tell you that if you want to remember this, you can remember this: refractive index of deciduous tooth, that is especially enamel, is equal to the refractive index of the milk. So also we tell it milk tooth. Now in enamel we can see here it is more permeable, less calcified, so more caries suscepted. But here they are less permeable, more calcified and less caries suscepted. They show more obtrusion and they show less obtrusion. Roots are near the rods near the cervical margin are perpendicular to the dentino-enamel junction, but they are directed apically and form the obtuse angle, okay, at the dentino-enamel junction. So that as they are perpendicular to the dentino-enamel junction, so during the cavity preparation in the enamel we should have to do beveling too. If we don't do beveling at that point, then there may be present of the unsupported enamel, which can lead to the failure of the restoration. Similarly in the pulp cavity and the dentin, we can see here dentin is less thick and here it is more thick. Pulp cavity is larger here and it is smaller here. Pulp horns are rises up higher in the cuspal region and lower at the cuspal region, and it have one clinical significance that during the cavity preparation in deciduous dentition, baby tooths, we should think that as pulp horns are rises, pulp horns are at higher level in the deciduous dentition, so they may feel more sensitivity during the tooth preparation. Okay, they may feel more sensitivity during the tooth preparation, and also pulp is very near to the tooth surface. Okay, so the blood vessel in a pulp would be injured during the tooth preparation. After that, we will discuss with the root. In the root we can see they are shorter and delicate in a deciduous dentition, they are longer and they stronger in a permanent dentition, but they are relatively longer than its crown. Okay, Here they are longer than its crown. They both are quite similar in both. The dentition root diverges widely here and root diverges less widely here. The bifurcation of the root is closer to the crown. Bifurcation of the root is not much closer to the crown. This means that the trunk, okay, the trunk of the root is smaller in the deciduous dentition, but it is larger in the permanent dentition. Similarly, they resolve the naturally allowing exfoliation, but they do not resolve under the normal condition. Okay, so there is a physiological exfoliation, so it is also called as deciduous dentition, but there is no presence of any sort of exfoliation. Occlusal area, it is narrow because the buccal and lingual surfaces converge occlusally, but there is broad occlusal area. Similarly, in cervical portion, we can see that rods of the enamel ends abruptly, and here the rods of the enamel ends gradually. Neck are short and more constricted here, and they are longer and less constricted in a permanent dentition. And first molars show the bulge at the cervical margin at the mesobuccal region known as the cervical ridge. This is a characteristic feature, okay, for the first molar. Okay, so in first molar there shows a bulge, okay, at the cervical margin at the mesobuccal region as a cervical ridge. Okay, so we call that as a cervical ridge, but no sort of any kind of bulge is present in a permanent dentition. Similarly, when we see the function, in function we can say that deciduous dentition, as they both are tooth, they both are dentition, they would help in chewing, speech development, jaw growth. Okay, they would help in chewing, tearing, okay, sort of things can be done by our tooth. But the main thing is there, it helps in a jaw growth and speech development here in the deciduous dentition, but it is not so in the permanent dentition. Okay, so it is quietly involved with the aesthetics, speech and occlusal stability here, but they maintain spaces for the permanent. And similarly, after that, when we see the interdental species in a deciduous dentition, it is a bit normal in deciduous dentition, but it is quite abnormal in a permanent dentition. Okay, looking such interdental species in a permanent dentition should be abnormal, and braces would be applied to that. Similarly, in the development, everyone know that deciduous dentition is developed from the dental lamina, and permanent dentition is developed from the lingual extension of the dental lamina, and the last three molars, okay, it developed from the distal extensions of the dental lamina. So this development portion I will be covering in another video properly, and I will prepare a proper playlist of this development of every portion of the tooth. Okay, so guys, don't worry about that. And so this was for this video. And so if you love this video, please do like, subscribe and share with your batchmates, and I will see you in the next video. Till then, stay happy and happy studying. Thank you.